I have 8 o'clock and we're just one senator short of Senator Norwood is not here yet. And I know I talked to Senator Hops and he is on the way. I'm not sure if he will make it in time, but we're going to go ahead and get started here. Our meeting this morning, as you know, we picked an early time. We're trying to get all of these budget hearings in as quick as we can in the session while we have what I would consider downtime. And so I appreciate you getting out early to make it here. So I'm going to turn it over to you to just give us a summary of your the status, and then we'll have questions and things at the end of that. So Dr. Cleveland, if you would just lead us off here. Yeah, just push it hard. There you
go. Currently, we have 14,145 licensees, an almost 50% increase since the beginning of COVID. 5,959 of those licensees list their primary practice address as the state of Mississippi. 5,316 of those list their practice address outside of the state of Mississippi, most of which are telemedicine doctors. We have 2,870 licensees that do not list a primary practice address. And for the most part, those are new licensees since April 1st of 23 that have not gone through a renewal cycle yet. And that's where we pick up practice addresses. The medical board is responsible for protecting the safety of the public, specifically to make sure when a Mississippian goes to see a doctor, a podiatrist, a acupuncturist, that is a safe and productive visit. To achieve these goals, the board licenses and investigates licensees. In a calendar year, we process and license approximately 2,870 physicians and other healthcare professionals. That's an average of 239 applications a month that we complete and license. Additionally, we renewed 1,336 interstate compact licenses, which is a labor-intensive process outside of our normal renewal system. We expect that number to grow to over 2,000 this year. Licensure is a complicated process, which the applicant must account for every day of their life since completing medical school. This must be verified by hospitals, clinics, and other records that prove where the physician was at any given time. Additionally, verifications must be received from medical school and residency programs to verify their training. Once this information is received and verified, it takes an average of less than 1 week for the license to be issued. Based on the over 500 complaints that were received and reviewed in the calendar year 2023, we opened approximately 150 new investigations. In any given month, we maintain approximately 75 open investigation cases. These investigations are labor intensive. Chart reviews are tedious and require an eye for detail. Although the majority of these are within our state, more often we're starting to see investigations carry us outside the state of Mississippi with telemedicine, multi-state licensure. We are facing unprecedented time when it comes to investigating licensees. Multi-state licensure and corporate medicine have increased the difficulty and the cost of investigating violations of Mississippi statute and medical board regulations. The Mississippi State Board of Medical Licensure has requested an increase in total spending authority of $996,495 for fiscal year 2025. That can be broken down into 5 categories. The first category is headcount. The board is requesting that the 2 positions deleted in the fiscal year 2025 base be restored. The second category is salaries. The board was in the process of filling 4 vacant positions while the fiscal year 2024 appropriations bill was being written. Unfortunately, the board was unable to fill those 4 vacant positions due to a reduction in spending authority. We are requesting an increase in spending authority of $168,209 to be able to fill these positions. We intend to fill the following vacant positions. Number 1, Administrative Support Assistant, Level 4. Number 2, an Investigator, Level 2. Number 3, Customer Service Representative, Level 3. Number 4, Customer Service Representative, Level 4. Additionally, retaining trained investigators and key licensing personnel is critical for the board. To best accomplish this, we are requesting an increase in funding for staff progression in the amount of $239,286. The third category is capital outlay equipment. We are requesting an additional spending authority to purchase and install an updated audio system for board meetings, regulatory hearings, and staff presentations in the amount of $69,000. We have implemented a long-range plan to replace 25% of the computer hardware each year over the next 4 years. Requested spending authority in the amount of $20,000 will help us accomplish this for the first year. The fourth category is subsidies. During our budget hearing before the Senate Appropriations Committee last year, chaired by Senator Jackson, we were asked for ways we could make a return to our licensees. After review of current cash balances, it was felt the best return would be to provide our licensees with an opportunity for continuing medical education, CMEs. These CMEs are generally an expense that is incurred by the licensee to remain certified and registered. By statute and regulation, physicians are required to attain 40 CMEs every 2 years. This conference would be open to other licensees for their CME requirements as well. We are proposing a pilot grant for an in-state 3-day conference. For this endeavor, the board is requesting spending authority in the amount of $500,000. This would include national speakers, breakout sessions, and networking opportunities for the physicians that we license. We are additionally currently researching ideas for outreach to medical students so that they can learn what the importance of the medical board is prior to becoming a licensee. I'll be glad to answer any questions y'all may have.
Sure, I'll kind of start here. I had a few just kind of prepared to begin with, and I think you touched on a couple to begin with here. So the Medical Licensure Board oversees the MDs, DOs, PAs, radiology assistants, acupuncturists, X-ray machine operators, and podiatrists, correct?
Correct.
Okay. And do you know just offhand, what are the fees for the board fees that they pay each year, their licensure fees?
The renewal fees for MDs and DOs is $300, and that is, I think for physician assistants is $300 as well. But the limited X-ray people, that's a very small number. I don't know the exact number.
Right. And podiatrist?
Podiatrist would be $300 as well.
And you mentioned the pen, so you have, 4 basically vacant pens that you're looking to fill or to get someone back in. One thing that kind of jumped out to me on the salary progression on the information I got is it a blanket 10% raise for each one of the staff across the board?
I'm going to ask Mike Lucius to jump in and help me answer that question.
Mr. Chairman, the progression is based on all of our staff with one exception, and that's Dr. Cleveland, because his salary is set by the board.
Okay.
So this would be for the core staff.
So for
10% across the board.
It is 10%.
It's 10% across the board. That's a number that is certainly higher than the other 13 subcommittees that I'm kind of looking at, under this. So can you give me the reasoning for that?
Well, because of the way the progression was set up last year, we were unable to give anybody progression in the current fiscal year. So we're having to make up to ensure that our staff stays above the minimum and right under the market, which was what SEC squared set up.
So you had the SEC square progressions the year before, but you did not have any progressions last year?
We didn't have any in this current year.
Okay, so the last progression was year before last?
Yes, sir.
And at that time, it was the 2.5%, 3%
Yes, sir.
number that we got from that. That'll be a number two that if we could get that, we would probably like to look to see kind of where these salaries kind of fall in line with other boards, because just because the request, with your fund balances, I'm not gonna say your request is out of line, but I certainly want to explore that a little bit more to kind of see if that is in line with what we're seeing and what we're wanting to do with some of the other licensure boards and special funds that we kind of look at.
Yes, sir.
The next question goes into the CE program. As I'm very familiar with CE, as you know, is the medical association, is it not providing 1 or 2 meetings per year anyway? Is that not the current?
So to my knowledge, they have their big annual meeting, which is CME in the Sand, and that's held down in Sandestin, Florida.
Right.
And that's their big event. And then they hold some smaller events really through the Physicians Health Program that provide the 5 hours of prescribing for controlled substances. And I think there's either 3 or 4 of those that they hold around the state in different places. What we're proposing is, and those are all at a cost to the licensee.
Right.
We're proposing that we would cover the cost of the CMEs themselves, give back to our licensees since, they paid a lot of money into the system. And so we thought the best way we could serve them was to provide some CME opportunities for them.
So, and now I understand the purpose. I just, I don't know that precedent has been set, in any other situation that I've seen before to use the licensure fees for continuing education less, so the way I always think about, boards versus association is the board's obligation is to the people, through your investigative means and things like that. And your association's obligation is to the practitioner, and so when we kind of move those lines across and we have the board then obligating itself more to the practitioner than the people, it gives me just something I need to, do a little thinking about. And because I certainly wouldn't want that to be what the board kind of saw as their mission going forward. Now, contrarily, if the meeting was designed just specifically to deal with, new regulations and new things that have come up, and was geared towards, the, licensure or some of the problems you're describing with telemedicine and that kind of thing. I see that more in line with the, the capacity of the board, but to just do it for just, general, CME is a concept that I want to talk to the chairman about a little bit, maybe after, and love to, have you give that some thought also, because I'm unfamiliar with that concept. You mentioned the telemedicine issue, because this is, in my opinion, becoming something that we really need to get a good, firm understanding of what we're doing here. Because what I'm finding and what I'm seeing is, although I think we're all in agreement that telemedicine conceptually is a good idea, it gives me pause to hear that we have so many new licensees coming into the state and getting a license who are not listing Mississippi as their primary location. And, the fear on that would be, as a practitioner myself, is that we're moving the care of Mississippians outside of Mississippi, which is probably not what you would like to see as a whole. Would that be a fair statement?
So that's a fair statement. My concerns go far beyond those. But what we have happening that people are using the term telemedicine for is not the practice of medicine. I mean, it's just simply a phone call or even downloading an app or logging into a website and getting medicine shipped to you
Right.
without any history being taken, any physical exam being performed, any past medical history being reviewed.
Yeah, and I'm a firm believer in the doctor-patient relationship being established
No,
as a primary
yeah, no
need that we have.
doctor-patient relationship being established. And, a lot of the times these people have gone to the extra length of actually becoming licensed in Mississippi, but the more difficult ones are the ones that don't even bother to get licensed in Mississippi.
Right.
Because we don't have the ability to investigate them really.
Right.
Once we cross state lines, we're just regular people when it
Right.
comes to investigating.
Right. And you go back to the North Carolina Supreme Court case, and regulatory authority and things like that becomes even more of a clouded issue. The thing too, since we did pass the cannabis law, it seems to me that we maybe have some new players in that marketplace who are just kind of delving into that, and that's a concern. Have you seen any uptick in the applications since, I guess, in the last 2 years compared to maybe the 2 years before that?
For cannabis certification?
Or either cannabis certification or just in new licensees who may indeed just be looking for that as a supplement to their income?
So year one of medical cannabis, we wrote regulations that required them to notify us if they became a certified physician. The law was changed in year two that said we could not require that. And so we don't have any ability to track those now.
Okay.
I can tell you that we do have a couple of investigations. The law still does say the first visit has to be an in-person visit. And we've got a couple investigations where that's not happening, where it's just a phone call and then they're certifying the patient for medical cannabis.
Right.
Once again, those are very difficult. The physician may be in New York or California. And that causes a lot of difficulty with being able to reach out and contact them, investigate them, get patient records. Certainly it's at an increased expense if we are able to do it.
Right.
And then what we are also running into is that even if we do prove somebody has violated Mississippi statute or board regulations, these corporate entities have so much money involved in them that they're throwing the whole bank at us essentially to defend their licensees, because they know if we'd ever knock one of them over, they're going to all start falling.
Right.
And so we're facing multi-state attorneys coming in and defending these licensees from out of state, these kind of high-priced lawyers.
Right.
I've got one case right now that has a Chicago attorney, a Dallas attorney, and a local attorney.
Yep.
And so these are really difficult cases. I'll just, 6 years ago when I first took this job, it was all, for the most part, it was all local attorneys. We kind of all know each other. We could agree on what the violations were and where this was going. This is turned into more of a medical malpractice type hearing or even trial,
Right.
if you want to go that far, where they can take it certainly all day, if not go into day two. We haven't had one go into day 3 yet, but I don't think we're far from it. And, those are very difficult to schedule. We got 9 board members that are working physicians. And so.
I understand,
And the difficulty of everything is becoming exponentially larger.
And I would love to work with you to try to help find some ways to kind of plug those holes, because, the dollars of, the AG's office going after someone, across the state line are not efficient dollars for our state, and I don't know that, because, for your board, the AG has to do the prosecutorial part of it. And I don't think that would be a good use of our dollars. So back to how we started this, telemedicine, good concept. abuse of telemedicine or stretching or working around telemedicine in certain ways is a problem I think we need to tighten up a little bit more. So, in many professions, we've got UROLA and other things that we passed here that, I think are important considerations too.
Yeah.
I do want to move to more of a positive. Last year, the chairman and I worked hard to set up a residency program. I think we invested $3 million of ARPA funds into that residency program. Have you seen or have you heard from any of your colleagues some benefits out of that?
Is this the one in the Delta?
Well, what we did is we set it up as a grant program, and so any hospital or facility that was adding or beginning or starting or adding to an existing residency program could apply for the money. And it's my understanding that all of the money was applied for and used. And the intent of it was to try to increase residency opportunities, to your point, in more of areas like the Delta, because the thought is that if they do a residency in an area they're not familiar with, they might indeed stay there. So I'm giving consideration this year to trying to maybe look into some more funding for that. And do you see that conceptually as something that's a good idea, or that, it may not be something that you're even familiar with, but just any comments you have on that would be helpful.
So the direct answer is it's not something I'm familiar with, but I can tell you that we have more medical school graduates than we have residency positions. And that's a problem as well. And what to do with the medical school graduate that doesn't get a residency program. And I remember 2 years ago, and then the idea kind of fell off to the side. We had talked about creating a license for them. I mean, certainly these are highly educated people that could be put to work in useful ways until they can find a training program. But that never evolved. So to answer your question, I don't have any direct information on it. And I can familiarize myself with it to the greatest extent possible. That might be a better question for Office of Physician Workforce than it is for us.
Okay. And just another, I've already asked about the cannabis here. And then, a lot of the issues we've talked about this morning are issues that affect more than your board, and so, in particular on some of the issues with maybe some bad players being involved and, the things we've talked about here. I would love to see over the next few years an ability for your board to work with some of the other boards that are experiencing the same type of problems on additional applicants, additional licensees who are maybe outside the state, and come up with some creative ideas on maybe how we can encourage people to come to Mississippi, but actually come here, instead of just having them just kind of tap into the marketplace. So I'd love to talk to you about that, maybe as a sidebar afterwards. But
sure. If I can just briefly tell you, I mean, we do work closely with Board of Pharmacy, Board of Nursing, Board of Dentistry, Health Department. We meet once a month, all of the directors and deputy directors of those health agencies. The other health agencies are invited. They don't always come. But, so we do work together on a lot of things.
Okay. We can talk more about that outside, but I think those were the questions I had. Open it to Senator McClendon.
Thank you, Mr. Chairman. On the rising claims of telemed, how many of those claims are the patient talks to, say, a nurse practitioner, and then a doctor signs off on it?
So we wouldn't investigate the nurse practitioner. That would be Board of Nursing.
Correct.
But if the nurse practitioner has prescriptive authority and is actually engaging in the practice of medicine, then that would be within
The nurse.
allowed, right? So.
Because these plans that are sold by brokers, agents, telemed is a big, one of the chips that you sell for the plan. Is the Department of Insurance notified when there is some sort of complaint or when there's found that there was unjust due to because I mean, it's getting paid by an insurance company. So is the Department of Insurance involved at all when?
So no is the answer. And the medical board does not involve itself in insurance claims or any type of payments that's specifically spelled out in statute. So
Would that help the matter if the insurance company's hand was possibly slapped or, notified, you've got, this has been a problem?
You mean the lack of coverage for certain?
No, I'm talking about they're letting this provider be their telemed.
Well, and now that you mention that, we do have one case we're investigating where the insurance company forces a telemedicine visit prior to going to see a local physician. And whether an actual physician-patient relationship was established there and was it the legitimate practice of medicine? I can tell you superficially, having looked at it, it doesn't appear so. But we've only had one situation like that I'm aware of right now.
And it's an insurance company that's requiring a telemed before an in-person.
Yes.
Thank you.
Chairman Hobbs.
I guess I'll use this for the benefit of those that may be watching online. Let me follow up with a couple of things that the chair has asked and also Senator McClendon on Senator McClendon's question. Where is the line drawn between the nursing practice and the medical practice? I mean, I would assume you have the authority to investigate the unauthorized practice of medicine, correct?
Yeah, so absolutely. I mean, the unauthorized practice of medicine can take a lot of different forms. It could be a licensee of another healthcare board, which initially we would turn it over to that healthcare board and then work with them if they needed help doing the investigation. With nurse practitioners, we would work with the Board of Nursing. They would handle their licensee. We would handle our licensee that should be in a collaborative agreement with that nurse practitioner as far as have they done what they're supposed to do? Have they reviewed the charts? Mm-hmm. Have they held quarterly meetings with the nurse practitioner to educate them on what they see as deficiencies in their practice?
Yeah, I'm not sure I can, this may take too long to get the exact answer on what I'm going. I had a good hearty debate last night with one of my colleagues in the Senate about where is the line drawn between what an NP can do and what the MD or DO should do? And, neither one of us could really answer that question. And I'm not asking you to try to answer that question today, but I think that is, we always have scope of practice debates and issues up here. And that's where I think a lot of people get hung up. And I'm just trying to look for help in knowing where is it that and I'm using the example of NP, but there are other areas too. How far can they go in what they're trained to do before they step over a line, and how far should, we need a lot of practitioners out there to help because we've got medical shortages in our state, but just helping us understand so we make good decisions here on, where the line is, where you need collaboration with the physician and where they have the authority to do certain things, maybe without collaboration. And it's maybe more rhetorical, if that's even a question. It's probably more rhetorical than it is. But if you've got data and information, I'd love to get it at some point.
Well, briefly, I would tell you that like the scope of practice of nurse practitioners as far as what they are allowed to do and what they are not allowed to do is either decided by statute or Board of Nursing. The medical board has no say in that. If we think that a nurse practitioner has crossed the line into
Unauthorized
practice of medicine, once again, our first step would be to notify the Board of Nursing and then to work with them to figure out, where violations may or may not have occurred.
Okay. I just still think well, anyway, we could debate that for a while, so I'll leave that alone, but I do want to get a better understanding of where that line is, if there is a line that's, bright line, to Senator Parker's question, the chairman's question on the medical cannabis. I think you mentioned that sometimes they're going out of state. And if that's in our statute, I did not know it, but if they can go out of state to get their permit or license to be able to get medical cannabis, seems awfully dangerous to me because we
So-
can't regulate them then.
Cannabis certifications themselves cannot cross state lines because federally it's still against the law. And so only being certified in the state of Mississippi can you buy cannabis within the state of Mississippi and use it within the state of Mississippi. Any crossing of lines of that would be against federal law. However, a physician in New York can do telemedicine into Mississippi. And where we're seeing.
Is that physician licensed in Mississippi or not?
Yes, sir.
Okay, all right.
Yeah.
I just thinking, I
Well,
was
they
thinking
may
you
or
were
may
saying
not
they,
be. The
well,
ones we're investigating are licensees that
Yeah.
have licensed with us. But they're still not allowed to do the initial certification for cannabis without an in-person visit. And we find
Okay.
violations of that.
well, yeah, I think you ought to continue to pursue that. And I think the other thing is if they're not licensed, and I think that's what Senator Parker was getting to, if they're not licensed in Mississippi, we need to, if our law is not strong enough, we need to tighten that down. They need to be licensed in Mississippi to be able to prescribe.
There's a bill before y'all this year that would increase our
Okay.
ability. to
Okay. All right. Thank you. And then final question is related to the budget. One thing I was looking at is in your kind of narrative handout that you've got, it says that y'all were looking for spending authority and didn't have money. And I was,
Last year.
yeah, but we had, and I'm confused because I'm just looking at our account. We had 400,000 extra in salaries last year. And then I'm seeing that that y'all were short or cut. It says due to reduction of spending authority on salaries. And I didn't remember there being a reduction. I don't have all the notes and I look at well over 100 budgets. So I can't remember them all, but it's
I'm going to give just a brief answer and then ask Mike Lucius.
okay.
to help me answer this. But toward the end of the budget process last year, my memory is that there was kind of an across the board cut. And we lost a significant amount of spending authority in that as far as being able to hire those 4 positions.
Okay.
And Mike, you.
So, Mr. Chairman, when the appropriation bill was written, we were in the process of interviewing for these positions, and the projection would have been more than that $400,000. In working with the Legislative Budget Office and the State Personnel Board, there were some errors that went on that we've been trying to get corrected, and we're still working through that. I know that's not a direct answer to.
Well, I think what I understand is we gave you more money last year, but we didn't give you as much as you wanted. Is that a fair statement?
That would be a fair statement to
Okay.
fill those 4 positions.
It said we reduced funds and I was like, well, that can't be right because I'm looking at the numbers and there was actually $400,000 increase, but okay. And you've given, I'm sorry, I walked in late, but you've given the chair the request for positions this year, correct?
Yes.
Okay. All right. Thank you, Mr. Chairman.
And Mr. Chairman, I think before you arrived, we went through the 4 new positions, which is part of that request. And we'll get together on the spending authority part of it. There was also, to your point back again about licensees from outside the state. Dr. Cleveland mentioned that there were now a large number of Mississippi licensees who were listing their primary residence as outside of Mississippi, and then several hundred who just did not list at all. And that is a new, I think, phenomenon, that I think we need to just be given some attention to. And I'll mention one last thing too, because it touches on PBMs and VBMs and these benefit managers that are across the entire country now. Have you seen, within medicine, a lot of move for consolidation of practices, outside capital purchases in to, kind of acquire a number of practices, that are then run, maybe outside or using managers outside the state, as a model or a method of providing medical care?
So mostly where we see something like that is hospital systems that are managed, not necessarily completely within the state, but
Not as much in, say, specialties.
I mean,
where-
without drawing this
so-
out for another 30 minutes,
Yeah.
we would just need to talk on the side and let me tell you what I do see.
Yeah, because I'm planning to look into some situations like that. And I wasn't aware that that might be impacting you. And so I'd love to get some feedback on you about how that might be affecting professions across the state too.
What we see on the illegitimate side of things is large companies essentially paying physicians for their credentials to be able to do things that the physician's not actually involved in. And then they're using that for unlicensed people to be able to practice medicine, essentially.
Right. But I do look forward to, and I'll mention at the end, when you mention the professions that you've been working with, I'm an optometrist. I feel like at this point in the game in Mississippi that we're not looking for any change in our scope. We're not looking for anything. And so I would love to see your board come alongside ours because we do have similar issues, and 50 years ago, the MDs and the DOs, they had their battle. They got to the end of their battle and now they work together. And I would love to see that happen, across our professions, because I do think we have the same problems, and if we're working together to solve those problems, I think we can make a bigger difference for our professions and for the people that we see as patients.
Certainly, comparatively, we have more resources than the Board of Optometry, and we would be more than happy to help them any way we can.
Absolutely. So, any other questions, Senator Butler? So we appreciate it, and we'll probably, if we could, the only piece of information that we ask for is on the 10% progressions. If we could get, a copy of that and, current salaries, how that looks, and so we can take a look at that. But appreciate all of you. Look forward to having more discussions
Very
with you in the
much.
future. Okay, I see pharmacy is assuming the positions already. So I
We're assuming
appreciate
that
you.
we're next.
Yeah, you are correct. You are correct. And
I know y'all like to
Yeah.
stay on schedule, so I'm trying.
yeah, we're only 10 minutes behind, but we're going to make up some ground going forward here. So
Okay. Good, maybe ours will be short.
So I'll tell you before you start, I don't have as many notes and as many questions for you as,
That's good.
as the first licensure board.
You know, that's
But,
fine because the more y'all ask, really, the more you get to know us. So I'm okay
Yeah,
with that.
But I already piqued your interest when I used letters like PBM and things like that.
Oh,
in
yes,
and
that's,
so-
that's the reason why I have Todd with me because he's
Right.
our expert.
So if you would introduce yourselves first and
Okay.
then just, I give Tracy just another moment to pass everything out here.
You ready for me to start? Make sure you can
Sure.
hear me.
Yeah,
Okay.
just introduce yourselves and then just give us a rundown on
Okay.
what you have going on in the Board of Pharmacy.
Okay. My name is Susan McCoy and I'm the Executive Director with the Board of Pharmacy. And I have with me my Associate Director, Todd Deere.
Good morning.
We appreciate y'all letting us come and have a few minutes of your time just to kind of tell you what the Board of Pharmacy is and what we do. Lots of new faces for y'all this, Mr. Butler, he's been on our committee before, but I think most of y'all are new to this committee. So I'm just going to kind of give you a little rundown about what the Board of Pharmacy does, because honestly, most people don't really understand everything that the Board of Pharmacy does. So I wanted to kind of give y'all that little bit of heads up about what we do. The Mississippi Board of Pharmacy was created in 1920 to protect and promote the health of Mississippi citizens by regulating and controlling the practice of pharmacy and the distribution of prescription drugs and devices. This authority includes the enforcement of the Mississippi Pharmacy Practice Act, that includes the Prescription Monitoring Program, the Pharmacy Benefit Prompt Pay Act, the Pharmacy Audit Integrity Act, and the Prescription Drugs Consumer Affordable Alternative Payment Options Act. It's a mouthful. The agency is organized to optimize this mission. The licensure division oversees the registration, the licensure and regulation of pharmacists, pharmacy technicians, and students. This division also permits facilities that manufacture, maintain, distribute, and dispense legend drugs and controlled substances. These include wholesalers and third-party logistics facilities. The compliance division inspects facilities, investigates licensees, and responds to complaints filed by the public. The activities of the compliance division often result in board administrative hearings and, when necessary, disciplinary actions as prescribed by the current Mississippi Pharmacy Practice Act and the regulations. The Prescription Monitoring Program, or the PMP as most people know it, maintains a database of dispense schedules 2 through 5 controlled substances, medical marijuana, plus additional drugs specified by the state. The number one objective of this program is to reduce prescription drug abuse by providing a controlled substance dispensing patient profile to practitioners who administer, prescribe, or dispense controlled substance drugs. This system is utilized by pharmacists, dentists, medical doctors, nurse practitioners, and law enforcement officials that have active cases. The Pharmacy Benefit Manager Division licenses PBMs and helps ensure appropriate patient access and services are provided, as well as compliance with the Prompt Pay Act. Our staff is highly trained on very complex issues. The staff is charged with ensuring that the drug supply coming into our state is intact and that only safe medications are available to our citizens. Physicians, nurse practitioners, dentists, and all other prescribers depend on the safety of the products for their patients, and the Board of Pharmacy is charged with the regulation of those products and their distribution throughout the supply chain. This regulation now includes products that have been distributed into Mississippi from other countries. As some of you may have heard at the public health hearing last week, there are many concerns about our products that are being imported into the United States. In the same way that we have illegal people and illicit controlled substance drugs entering our country, there are drugs that have not been through the rigorous testing process that the facilities located within the borders of the United States have to go through. Our charge is to regulate prescription drugs to the best of our abilities, to fill in the gaps on quality the federal government may not be addressing, and to ensure the residents of Mississippi are protected as much as possible. Compounding is another area of expertise that the board takes very seriously. Our staff is highly trained on the standards and federal law requires, and they are available as a resource to anyone or any other state agency that needs assistance with these compounding requirements. Pharmacy benefit managers are very complex, as you all know. The regulation of these entities requires a lot of time and effort to be knowledgeable about the laws, both federal and state, and the nuances of those practices pertaining to our prescription benefits. As you can imagine, a lot of training is required in order to be viewed by the public as the expert on PBM practices. The board staff, including licensing and every other department, have received extensive training to serve the public properly and effectively. Every facility licensed in Mississippi, both in-state and out-of-state, is required to have inspections that address all those complex standards. These inspections are reviewed at the time of issuance and renewal to ensure that the facilities comply with both state and federal requirements. Basically, what that means is when a non-resident facility applies at the Board of Pharmacy for a license, our staff actually goes through the inspections that other states and FDA do in those other facilities so that we can be assured that they're following the rules of Mississippi. And so that even our licensing staff is very trained in the buzzwords and the things that need to be looked at or elevated up to be reviewed by a pharmacist or somebody that knows a little bit more about that. We currently have 2 open positions. One is for a compliance agent that I anticipate filling by the end of this fiscal year due to an upcoming retirement, and we wish to have a lengthy training period. As I've discussed, the training required is extensive and will take time. The second position is our PBM position, which will be filled at the conclusion of an ongoing PBM audit. The information gained from this audit will help me evaluate and determine the skill set that's going to be required for this position. In the LBO recommendations, these 2 positions are funded, and we appreciate being able to keep those and use them as soon as possible. Due to the complexity of the pharmacy industry, the development of new products, and increases in federal regulations, the agency ensures that staff receives the robust training that I've discussed. The FY25 request includes $49,423 for salary progressions, excuse me, which provides an average of 2% increase for each employee based on the expertise gained through certain training and related job performance. These are very skilled positions, and we have spent a lot of time and effort getting these folks trained to be able to do the things that we're asking them to do at the Board of Pharmacy. And so it would be a huge loss to us to not be able to be competitive in the salaries that, so that's why we're asking for that. The board is also requesting to be allowed spending authority from our cash balance to offset the cost of auditing PBMs. Last year, we were granted the $500,000 escalation authority, and by the time we issued our RFP and granted the contract for $348,430, we were only able to award 1 audit. This will hopefully be completed by May of this year. However, we would like to conduct more than 1 audit, so we are asking for the same escalation authority as last year for next year. We're not real sure. The statute requires the PBMs to reimburse for these audits, but this is our first one, and we don't really know how that's going to go down. We do anticipate probably some pushback on that, so we'll see. But we would like to be able to continue doing these audits and to be able to see if we can peek into some of the practices that we're all hearing about and seeing. The board receives its revenue from licensure of pharmacists, pharmacy technicians, pharmacy benefit managers, and the issuance of the permits to the different numerous types of drug facilities. The fees collected each year and the cash balance is sufficient to fund the total request. Our cash balance as of January the 31st was 6.9 million, with 2,473,000 still coming out with our current budgetary authority, which will have 4.494 remaining. In the FY23, the agency contributed $314,139 to the general fund from fines and penalties and received no general fund money. Our cash balance, we realize, is a little bit on the high side, but there are several reasons why we're not just real sure exactly what's going to be needed out of that cash balance. FDA has put out some proposed language that could potentially take away some of our licensure. They are proposing to require third-party logistics to license with them instead of with us. And so that will take away some of our revenue, along with there's a potential there. They are talking about doing a national license for wholesalers, which also could cause some issues with the revenue that we've got coming in. So we may need that cash balance to help us until we can get stabilized with that. Also, the cash balance that we've got, you can see these PBM audits are very, very costly. And so we anticipate having to dip into that cash balance as we go along, at least until we can find out whether the reimbursements are going to come in from the PBMs for these audits. So that's why we're hoping to be able to keep our cash balance the way it is.
So because this is our first meeting with you,
Sure.
I gave a lot of leeway on just kind of going through the whole thing. And, for next year, when we go through it, we'll kind of stick to more of just the things like that. But I think for the benefit on everybody here, we just kind of plow through it a little bit more. But So in summary here, you have 20 pins, of which 18 are filled,
Mhm.
and you have a compliance agent and a PBM position that you're wishing to fill.
Yes.
And with your 2% salary progression, you're asking for 49,423 more than last year. Also, in going through the budget and the notes from last year, you did and are completing an office relocation, which is going to actually save you some money. Is that correct?
Well, we had to move. We didn't have a choice to
Okay.
move. With the location that we were in, our lease was running out and our landlord was not willing to do any of the state requirements as far as replacing the carpet, replacing the paint, doing the things that are required for the state leases. And so thank goodness we were able to, through some just independent connections, we were able to find out that Farm Bureau had some space in the building right next door to us. So Farm Bureau has been very wonderful to work with us. They had a space up there that they were willing to lease to us, and they have come in and done a wonderful job renovating it and making it fit to our
Good for
needs.
you.
And so we've been very blessed.
Yeah, and I know we had allocated some money for that before, which we're not allocating. And then the other request you have is just an escalation authority, correct, for up to the 500,000, of which you did not use much of it last year because you were just getting that process started. But
Right.
so those are your main requests this cycle. And in interest of time, we could spend a lot of time in this meeting talking about PBMs and that kind of thing. But like I mentioned earlier, I think there needs to be, some continued attention on that issue. And I don't think that this is maybe the best time and place for that. But I look forward to talking to you more, outside of this meeting about that,
Sure.
unless any of the other committee members have specific questions.
And there will be an opportunity, I'm sure, because we do anticipate dropping some more language. Our PBM language is not as tight as we would like it to be. And so we are looking at how we can to fix that or to at least help with some of those things. There will be some language that's dropped that will hopefully address some of the loopholes that are there now to help us be able to tighten some of the things. There have been actually some things that the board has wanted to take some action on. But then when the actual language got sent to the AG's office or to different places, with our attorneys, it just didn't look like we had a strong enough case to be able to do anything with. So we're tightening up some of that so that the board might be able to tighten up on some of the enforcement of what's already there.
Right.
Just tightening up some language.
And I look forward to more discussions and more maybe meetings and hearings on that. So look forward to working with you on that. So are there any questions from the committee?
Well, we've actually got a little one pager, so we can send that out to y'all. I mean, we can give it to you now, and then you can look at it, and then please feel free to call us if you have any questions. Like I said, we hadn't gotten the language dropped yet, but we will. It
That'd be
is
great.
coming. But this is just a kind of a little quick synopsis of the things that we are wanting to address in there.
Any other questions from the committee? So we thank you for your time today and look forward to working with you and
Thank
learning
you.
more. So
Thank you.
thank you.
Guys.
Okay, next up this morning, we've got the nursing home administrators. Okay, so I think we've got the handouts in front of us here. Yeah, thank you for being with us this morning. If you would introduce your group here today, and then, give us a little update on your needs and what you'd like to talk to us about this morning.
Yes, sir. Thank you. Thank you for having us this morning and for taking the time to listen about what we do what we do as a state agency and what we're requesting. My name is Carrie Rowden. I'm the executive director with the board. This is Denise DeRossett with Cornerstone. She handles our financial, most of our financial affairs. And then this is our board member, Mr. James Williams, and he's here to support us and talk a little bit. So what we do is we license nursing home administrators. By federal law, in 1970, they required that a licensure board be for every state that will issue licenses and regulate nursing home administrators. We have about 450 nursing home administrators. There's about 210 nursing homes in the state. So we have extra that are what we call regional administrators, which they oversee multiple nursing homes and multiple administrators. So they have a license, as well as we have some that are working out of state, but they want to keep their Mississippi license. We provide, they are required to have continuing education for renewal. We renew biannually. So we renew on odd years, which is when we bring in the most cash in our agency. We also have preceptors that train what we call administrators in training. It's an internship, about a 6-month internship. And the preceptors are licensed for 2 years, and we hold that in the spring. Our next program is in April. They come to that, they earn CEUs, and they also get licensed as preceptors so that they can train these administrator in trainings. The board meets, there's 7 members on the board. We meet quarterly, except if we have a complaint or we need an emergency board meeting to pass something. But the board regulates and set rules and also approves applications for administrative trainings, reciprocity, UROLA, endorsement applicants. And they're overseeing the agency. So Mr. Williams, would you?
Yes, thanks for your time, Senators. Carrie's been with the board for 20+ years. She only has one other employee in the office there. They basically manage the applicant through the training, 6 months of training, through the testing, and also when we get licensed, they manage us all the way to retirement as well, just at Central. And with no insult intended to the committee, nursing homes are one of the most regulated professions in the nation. We're up there with airlines, nuclear electricity and stuff like that. Carrie's office serves as our go-to for this 450 member family that we have. And she keeps us all straight. So that's brings us here today to request an increase for that office specifically. Thank you.
I'm going to talk just briefly about the budget itself. In the last couple of years, the legislature has given us salary targets that we have to use for those salaries. And last year, the salary target in this agency trapped about $5,000 because from what we needed, it was more than was given to us, but we couldn't give more than a 2% raise. And so what we're asking for is to untrap those funds and let the salary numbers be the actual numbers. And so we've given you a handout that shows what that is. And then we've asked for an additional $6,000 so that we could give a 5% salary progression in the next year. And that $6,000 does not give them that much. Carrie only makes $60,000 right now, which is well below what the state personnel board is for that position. The only other request we have is we put in about $5,000 into the budget last year in case the agency had to relocate. And that was like to help move their computers and things like that. They were fortunate. They were able to get their lease extended, so they don't have to have any relocation money. And so they were going to have that come out of the budget. But now we have learned that the computer system that they have, which is quite old, is going to be, the person who developed it is retiring. He's 75. And so he said it's time for him to leave. And so he's made arrangements for another company to take over that database, but we're not exactly sure what those costs are going to be. If there's going to be any increases, there could be some just portability issues. His rates are higher for maintenance. And so we're asking for that $5,000 that we had originally said to take out of the budget to be put back in there for those things that might come up with this change in the database.
Okay, so thank you for your summary, and I think we've all had your handouts to look out here. So in summary, you're looking to untrap that $4,600 from last year and asking for additional $6,000 to allow a 5% salary progression for into the next year, correct?
But that 6,000 includes that 4,000 that was trapped.
Right, so it's 10,000 total,
No.
including so the 6,000 is includes
We're only
the
asking for
4,600.
1,500 more
Okay,
if you
so-
untrap those funds.
Okay, so 1,500.
I'm sorry, I didn't
more.
mean to interrupt you.
Okay. And then, one thing in looking at, just the dollars in and the dollars out, in one of our forms here, I saw projected collections annually of, it looked like 201,000, and it looked like an expense request of 206,000 kind of total. How do we kind of reconcile that little difference in dollars in versus dollars out
So I do
perpetually going forward?
an analysis for every 2 years and look at what that 2 years revenue is. And so we are seeing an increase in those 2 years. We're actually collecting more this year coming up because they've just raised their fees. So
Okay.
we think we can handle the
So
increased
the
cost.
average over the 2 years will put you above the 206,000 overall request number. that
It
you
will.
have. Okay.
Mhm.
I think those were my questions on the budget. Any questions from the committee? We appreciate you. We appreciate what you do in the nursing home as the son of a father who spent time in the nursing home. I know it's very important, for you to get the training and education to the administrators out there so that they are doing their due diligence to protect the people who are in the nursing home facility. So we thank you for your work and service.
Yes,
Okay.
sir. I appreciate
Yes.
it. Thanks for your time.
So we're running a few minutes early, so everybody's taking just a second here. Representative, good to see you. I'll come down and see you, but we'll probably jump down here in about 2 or 3 minutes once everybody gets just a little second. So absolutely. Okay, Representative Beckett, it looks like you're up. Yeah. How are things back home?
Yes. We'll do it. We'll do it. Yeah. And if you ever need me to phone, yeah. Yeah. We know, yeah. Yeah.
Okay, so we'll go ahead and try to get started here. Our next group this morning is the public utility staff. And welcome our previous colleague in the legislature, Representative Beckett, is joining us today as part of this in his new position that I believe he's enjoying. But if you would, just all take a seat somewhere around the table here where you can see all of us if you can. And first, whoever's going to lead the talk, if you would, tell us who you are, what you do, and then we can have you go right into your budget needs.
I do welcome you. Senator Parker, I gentlemen, glad to have you here with us today. And all y'all gentlemen, I hope y'all enjoy serving as much as I enjoy my 19 years on the other end of the hall, but it is different being on this side of the table than that side of the table, having experienced both in other roles. It's a little bit different. But we appreciate your time this morning. We'll try to be respectful of that. I'm going to be doing the presentation this morning, but from our group, Jeff Lee and Emily Kruger here, and then we have fortunate to have a couple of our commissioners here. I think I'm going to have them just a little bit later on in the presentation. But I know our time is brief this morning. I don't want to waste your time. We turned in our budget requests to the staff back way earlier in the year, and subsequent to that, couple things have happened. And so our request today will be a little bit different than would be amended basically from what the staff had. The primary changes, and I'll go over that, and then I'll be glad to answer any questions that you might have. But we were last year, y'all funded 25 positions at our agency. Now, we don't have near 25 filled. Currently, we have 18 filled. That's gone up and down. And you might say, well, why do you need 25 positions? Yes, we need every one of them, and we are filling them as fast as we can. But due to various circumstances, they're not all full. That is a slight increase above what we had when I took over there. We were able to hire 6 people last year, but we lost 5. So, I mean, so it's a slow process. Actually, we've lost more than that. Recently, we've lost some to retirement. We lost some going to private sector. We lost some going to other government. We even lost one to local government. So for various reasons, but for the most part, our staff is very technical. And you can't go and hire somebody out of school that knows how to do what you're doing. They got to be trained to do that. And so that's some of what our request is today. And it's part of why these positions aren't filled. Just having said that, I'll just go over a few things. One thing, in last year's budget, there were 27 positions in the budget, but only 25 were funded. Because of some changes that have been made, we are requesting that y'all fund the 2 positions and let us keep 27 positions, but fund them this time, and I'll tell you why. One is the project y'all passed in special session last week, project number 2, which is going to increase our workload a great deal. And as you tell, we have a limited number of individuals. We don't have any excess capacity over there, and this will be additional work that will have to be done. And we're going to rely on contractors to do a great deal of that work. But anytime you have a lot of contractors working for you, someone at your office is going to have to be responsible. So we would really love to have basically a project manager. And we don't feel like, and I know that y'all probably don't feel like this is going to be a one-off deal. And even if it is, it's going to be a multi-year ongoing. And so that's one of the positions, and that's, we think 85 to 90,000, we can hire someone competent to do that. The other position we would like to have is a deputy director. Our gas and gas and electric division handles the vast majority of the volume in our office. There's a lot of water work and there's a fair amount of telecommunication, but the majority of the individuals in there working the gas electric, and we have lost our director. The person who was doing this was just hired away to a private entity. And 3 times before this, the last 3 people have been promoted from within, and which allowed this office to do that. But we can't do that now because of the inexperience of our staff. We don't have anybody that's in a position that needs to be promoted to that position. And just so happens that person was on our legal staff, was one of Emily's attorneys, and we really like to step back and keep that position and go back to having a more inexperienced, younger attorney, because it really helps us in our progression toward succession planning and all those type of things. So we're asking for y'all to fund that position that we already have, and us use as deputy director. So actually, that's would take around 100, about 115, 120,000. We think we could go out and hire somebody. We can't just hire an attorney. I don't know. I'm sure y'all all know how the pay constraints in state government. We can pay our attorneys and our CPAs a little bit more, but we can't, for this job, for what we need, we can't compete for that. But we think we can go out and hire somebody very experienced in this field that doesn't have that certification, or that they're not a lawyer, maybe not even a CPA, but they have 20, 25 years worth of experience and can more than capable of doing this job. We identified a couple people in actually that have been in similar positions that this, and we're talking with the personnel board, this would give us the ability to hire them and pay them what it would take to get that. So altogether, that's around 266,000 in salary, and that's the change versus what we'd asked for when we made our budget recommendation. The other things we've asked for is, I think, 25,000 more in travel. And somebody said, well, why do you want, we don't travel. You can tell travel is not a huge part of our budget, but really that's a misnomer, because that's really training. Because the travel, the specialized training these individuals need is in New Mexico and Michigan primarily, and maybe Florida or something, but you're gonna have to travel to do it. And we took part of the staff and sent this year, and we were able to squeeze money out of different categories and switch it around and just cut some things out to keep from having to ask for a deficit this year. We're going to probably make it this time, but the 25,000 increase would more than train all these new people that we're going to have to hire. And so we've asked for that, and we asked for a $42,000 increase in contractual. And the reason we're asking for that is we use consultants on our certain rate cases that we do for the utilities, but the addition for this year is that we've never done that for our water and sewer cases before. We haven't had these rate cases for them. But we have Great River, which has multiple systems, over 100 or more, and we're going to have a rate case for them this time. And so we're going to have a need for additional consulting that we haven't used in the past. So that would be the increase there. And to get just a little bit back to our vacancies, because I know that's always a sore point, and people may ask you about that. But we've had recent resignations and retirements, like we talked about. And so we have worked hard. We've hired 6 new people. But while we were hiring those 6, like I said, 4 left. And we've had and we have in the last month, we've had 2 other people who are past retirement time have indicated they may leave us within the next few months. Not for sure, but that's definitely a possibility. So we don't see that ending anytime soon. And I think y'all are probably aware of the problems of the Woolfolk building. We're one of the agencies that's drastically impacted by that. We're not in the office. We cannot work in the office. We're there. 2 or 3 of us are there from time to time. We come in and print what we have to print, do what we have to do, but there's no carpet on the floors. The sheetrock's off. It's not, they just don't want us in there, beside the fact that the buildings only can be partially occupied because of the fire marshal. As a matter of fact, they told us this week they're going to move us, probably to the 9th floor. But that's 2 to 6 months away. So we've been out since October. It's going to be out since then. So that's we've been able to keep up with work so far, but it definitely plays in our vacancies because of specialized training that these individuals have to have. We can't train them because they're working on teams. They need to be working with someone else for a year or 2, but really before they can be turned loose very much on their own. And we're not in the office, so it's inhibiting us. I'm not going to hire somebody and send them home and pay them. I guess I'm a little too conservative to do that. I just don't want to hire somebody if they can't come in and work, and especially if they can't go home and work either, because they don't know what they're doing. So we haven't been able to replace anybody, even though we have 1 or 2 individuals that would like to. We got about 5 positions that we desperately want to fill, but all of them require being in office really before they're useful to us. So we got that. You got the state pay restraints, which we have to deal with, and you got the fact that we're not there. And so, and as we hire them, that's just going to necessitate that we train even more. So we anticipated this would be a 2-year time frame, like the year that we're currently in, than this budget year. But we may even have to go into next year as far as the training, because we're going to end up with 5 or 6 more people that we're going to hire that probably won't be onboarded until the following year. And so, our goal is to get back to fully staffed. We are working that. We're getting close to the retirements being over. There were a lot of people in this agency 3 years ago that had 30+ years. Most have gone, and then we'll only be facing the fact that industry hiring them away from us. Well, I guess there's good news and bad news. The good news is that most of our employees are not experienced enough that the industry wants to hire them yet. They really want us to train them a few more years before that. So we're kind of that spot. If we've been blessed the fact that we have the ability to hire consultants, and that's kind of carrying us through this period of time of shorter staff and inexperienced staff. So any questions that that y'all
Sure,
have?
and just, and I guess to summarize the requests that you have, the request for the 25,000 in travel for the 10 employees was on the existing
Right.
submission that we have in front of us. The additional 42,000 for the contractual for the migration to the new GIS database system was in our existing one. My understanding of your $266,000 in salary request is that primarily, we talked a little bit about this when we were looking at the special projects, particularly with workforce development. I asked specifically to Accelerate if they saw a need for any potential new staffing needs in their agency to help kind of work through that process. And certainly with the data center, and some of the utility issues there, I certainly can see conceptually there may be needing to be some changes, but back to the pins, so at 18 field, 25 that we were set aside to pay for, 27 requested. I know in a perfect world, you'd like to have them all filled, but as we're thinking about our budget and things like that, you mentioned, you hired 6 and lost 5. Where do you think you most likely could get on that?
Honestly, we realistically are hoping to get to 22, 23 positions by the end of the year. The money for these 2 positions is far more critical than funding. I mean, you funded 25, there were 27 listed, 2 unfunded. If we gave up had to give up the 2 unfunded ones and just got the money to hire these individuals we need, that would more than meet our needs. But I can tell you that we're not going to hire somebody just for the sake of spending the money. We're going to have 300-something thousand left back. And I know that we're not a special fund agency, but truly we are a special fund because this is assessment on the people we regulate. This money, this is not money that can be used somewhere else if we didn't ask for it. And we're not going to spend it unless we can hire the people. Now, do we need 25? Yes, we need 25. But am I going to sit here and tell you we're going to get to 25? We won't get to 25 because we know we're going to lose at least 2. I mean, that would mean we'd probably have to hire 9 or 10 people. And we don't have the bandwidth to hire 9 or 10 people. We can't train that many people, but we can get to probably 22, 23 because we can handle that. And some of these people we're talking about hiring won't require training. A paralegal that we've been having to do without since I was retired that we haven't been able to hire won't require us to train them. The young attorney, we can hire and start working. If we could hire a project manager, we would hire somebody that knows what to do. And the same for the director. We wouldn't be hiring to get to 22 or 23. We would only be hiring 2 or 3 people with 0 experience that we would be having to train really. So, but honestly, 22, 23 is really where we would hope to get to. And a lot of that depends on how quickly we can get back in the office. If we get even lower before we get back in, then it's going to be hard to get to that number.
It's hard to interview somebody. I was over at Woolfolk yesterday for a meeting that normally would be on an upper floor, and we were having it on the first floor in a very tight, in the one conference room that's over there right now.
Yeah,
So I
and
understand
that
issue we have.
hire somebody, by the way, you may have an office in 6 months.
Yeah.
Well, you're not gonna hire somebody away from another agency or industry
Right.
or like that. You might get somebody straight out of school, but you're not gonna get anybody with any
Right.
experience like that.
So are there any other questions from the other senators? Because we're going to probably, what I'd like to do is roll right into the public utilities right after this so that we can just kind of finish quickly if we can. Is there any questions on the staff issues first, Mr. Chairman?
Well,
Yeah. But
But
they're not on their side of the building.
and also we have no vote. Y'all have the pen, so.
So I guess with that, if there are no questions on that budget, are there any other people who'd like to join us for the next part or any? Thank you.
Here.
See. Oh, really? Yeah. Okay, well, believe it or not, we're almost on time, and I know Chairman Hobson has another meeting. He's gonna have to sneak out, but like we've been doing at the previous meetings, it started at 4:30 in the morning today. Or at least it seemed like it, didn't it, Mike? If you will, whoever's gonna be speaking, if you would just introduce everyone. I think commissioners already been introduced, but you can introduce them again if you want to, and then tell us about your needs.
Thank you, Mr. Chairman. Who we have with us is our executive director and a couple of our analysts. Y'all know Jody Ray and the commissioners, Commissioner Carr from the Southern District, Commissioner Stamps from the Central District, and I'm from the Northern District, obviously. Thank y'all for having us. I appreciate it. Mr. Chairman and members of the committee. Our request for this year is $5,619,891. That's an increase of $149,000, I think it is. And basically what that's for, $185,220 increase. That's in salaries for 3 additional investigators, investigator 2 pins at $45,864 plus fringe benefits. Basically, we're asking for those 1 per district to help facilitate and work on the new special projects that we have going on. The AWS is going to be quite a heavy lift for us as well. So that's phase 1, and then they have phase 2 and phase 3. Obviously, there's phase 4 as well. So we'll be heavily impacted, involved in all that as far as the investigation side. So that's the genesis of those 3 pins for investigators. Also, the new economic development project in Marshall County as well. That's going to be a big impact, which again, we'll have to make sure that everything's in order there as well, as far as it impacts the ratepayers and power and water and sewer and things like that. The other increase is $45,000 for contractual services and public awareness. Again, that ties in again with the same economic development, and as well as there's what's going around the state is you're having a lot of water systems that are consolidating, and those companies are getting larger and larger and larger. And so that is an extra load for Public Service Commission to try to make sure that the ratepayers and those customers on those systems are taken care of. So it's a kind of a new phenomenon for our state, is that water systems are continuing to be consolidated by these bigger companies. So you go down the line items, you can see we have our salaries is the only increase. Travel is level funded. Contractual, we're asking for the same thing. Actually, it's a decrease. Contractual is a decrease of 237,500. That's based on the CTS last year. Yeah, that's last year. Correct. Commodities, equipment, and subsidies are all level. That's a brief explanation, Mr. Chairman.
And I had one other note here about a $282,500 request in CapEx funds to purchase a new case tracking software system. Is that outside of the budget? Is that a
Yes, sir.
special request?
We were appropriated that last year,
Okay.
and so that is not part of our request
Okay,
this
so
year.
that was last year.
Yes,
So
sir.
this is my first year with your budget, so
Yes.
you have to get me up to speed on
That
things.
project is almost finished.
Yeah, because I didn't see it in the budget, so my next question was if that was outside your budget, because I didn't see it in the budget,
That's right.
so, so that answers that question. And so, 3 new investigators each, for each of the districts overall.
Yes, sir.
One thing that has been, I think just coming to my attention just over and over the last year or so, up in our area, and I think about this as we look at the new economic development project coming up in Marshall County, has been the issues with the electricity and the needs in the Holly Springs area.
Yes, sir.
Can you give us an update on what's going on there and what your suggestions are? Because I know during the campaign, that was something that that was very important to the citizens up in the northern part of the state. And
Definitely.
can you give me an update on where we stand on that?
Appreciate that, Mr. Chairman. Yes, sir. We actually had a hearing last week where we brought in TVA and TVPPA. TVA is the electricity provider for that municipal electric power association there. So they did a report on findings and how they're trying to work with that utility district. And it's on YouTube. It's very enlightening to understand exactly what's going on and kind of the institutional issues that have led to a steady decline in the service of the people in that area. We also, the state last year, we appropriated funds to try to understand what was going on with the grid itself. So TVPPA was contracted to basically do a survey of the lines and try to figure out how bad is it. And that will really open your eyes too. They were there and they had pictures and they testified in how the system has degraded pretty substantially over the years. They even had one picture that wasn't in it, but a resident up there sent me a picture of, they have an older bucket truck that is literally attached to one of the poles, and it's been there for 2 years. The engine, the batteries are gone, the truck's just literally there as far as the infrastructure. So there's a big issue. They also testified to us that there's one community up there called Sladen. Sladen, normally they have redundant services, so they have lines coming in either side. So TVPPA did testify to us that there's only one line coming in, so there's no redundancies. If they lose that transformer, just one transformer, that community could be out of power for almost months.
And to that point, one of my buildings, we have 3-phase power, and we're fortunate to have, we're kind of at a junction where we kind of get power from kind of 2 trunks, so to speak. Again, that's not my specialty. And so when our power goes out, we usually lose part of it. We don't lose all of it, because we kind of get that redundancy. So I understand that. And, the Sladen issue, for example, in the patients I see in my office, it's remarkable to me how many of them come in and tell me about that problem.
Yes, sir.
I've never seen anything like it in the entire time I've been in practice, and they come in and tell me that, their power's been out a week and a half.
Right.
And they have learned a way to get around that. I mean, almost all of them have generators and they have different, it almost sounds like a third world, kind of country.
Mr. Chairman, we've heard it classified as that so many times by the people in the community, and everybody's being impacted. It's not right, left, black, white. It's everybody in that district is being impacted by this system, and they deserve better.
And how common is it for a municipality to have a system that they work and regulate outside of the municipal kind of boundaries? Is that a common occurrence in Mississippi, or is that, again, it's not my specialty, so I'm trying to learn as we're talking here.
There are some that serve outside the areas, municipal districts that serve that far. I think there's 13 1,000 or 12,000 connections on that system. They even go up into Tennessee.
Right.
So they cover 3 or 4 counties. I think we have 3 in the state that kind of operate that way. Holly Springs, New Albany, and Okolona.
So do you hope as a commission to bring us a recommendation on what to do about that or a solution, or do you want us to provide a solution for that problem?
We have been working hand in glove with Senator Whaley and Representative Kincaid on the House side to try to come up with a solution to give relief to the people in that district, and also with the governor's office and TVA and TDPPA. So we're working on a legislation that Senator Whaley hopefully drops this week or next week.
And I'd love you, if you would, to also keep our committee informed on that. Just the subcommittee here.
Yes, sir.
You don't have to, because I know particularly Senator McClendon and I, as people who represent that area, we want to see a solution for that this year, because it is these needs for basic services across the state are a priority that we just have to deal with and just get fixed. So.
Well, it hurts economic development in that area. We talked about the new project going up there. Of course, they're not in the HSUD. Of course, very few companies would consider locating in that area because of the lack of reliable power. That's a huge economic engine, is to have reliable, cheap energy. And right now that area does not have it. They again testified to us that a lot of people are anybody that's building a new house, they don't get hooked up until they literally say, we're about to lose our funding. And then they get prioritized.
And we do have existing power providers in the state who are willing or looking to hopefully assist with that. So we do have players that can come along this situation, hopefully provide some solution or relief for this.
Yes, sir. And we've included the EPAs too, the local co-ops, to try to make sure that we have a solution that basically gets the help to those ratepayers right now. And it's pretty grim.
And just my last question here, is, for new commissioners. So how has the experience been in coming on board? And I'll let someone else speak if you want to.
Yeah.
I had you on the hot seat for long enough, Chris. But how has that been? And kind of give us an update on where you feel your process is going here.
Well, first and foremost, thanks for the attention today. Thank you for the time. I've been overjoyed with our experience. We got a good group. We finally have 3 commissioners that have a vision for Mississippi's future and the courage to see it through. We're pretty much lockstep on everything. So when it's dealing with Holly Springs, it's personal to me. And I go along with whatever Commissioner Brown is focused for. And the same thing in the Southern District. So we got 3 commissioners who are working together, and the staff has prepared as well. So we just need a few more resources to keep our fingers on the pulse of these major projects, because Amazon is not going to lose, but we got to make sure that the ratepayers don't lose. And that's why we need a little extra resources to help keep our finger on the pulse.
And to echo what Commissioner Stamps just said, we had meetings this past week about trying to address some of the issues in his district as well. So like I said, we're lockstep to serve the citizens of the state and the ratepayers. Commissioner Carr.
You push it for a little longer. The green button and the little black button at the bottom.
Oh, thank you. Commissioner Carr, new to the crowd. Again, thank y'all for your time today. From my perspective, Holly Springs is very important. Some of the gentlemen talked, the co-ops you talked about coming in assisting. They're concerned when they come in, they don't have anybody that can give them a clear path to when the power's off. And from my background, being an electrician, developer, that's very important for the safety of those linemen that come into the area. And they're not getting any help from the community, from the leadership in that area. It's sad that we're at this point. I don't quite understand it myself, because it's a necessity in life. It goes all the way across the board. It goes to our schools, to our daycares, to our healthcare facilities. They need to have that. That's a necessity of life, is our grid. Our utilities, they need to be, updated tremendously. It's going to take a lot of work, and we're all working together. Our staff is working. I've directed my staff to reach out to them in any capacity they need. Our state is growing, as y'all well see, and it's not growing just here, it's growing on the coast. People from outside our state are looking at our state for growth, and utilities is a main topic. Electricity is what everybody's looking at. And my research and my background, our transmission lines are in pretty good shape. Our distribution, they need some work. We have a backlog with transformers. They're 18 to 36 months out. When you get up into the bigger transformers, like with Amazon, they've already placed that order and it's coming. It takes a little bit of time. You just don't go down and pick up one off the shelf. So it is a tremendous task that we're up against. And I'm thankful that I have brothers here that are willing to work with us, and we're going to work with them. And again, I thank y'all for your time.
And I'm very happy to hear that we have a united front to deal with this problem. And, and to that, the way this building works is that, we need to all hear that. So I would love to have, just something from you on, just, it could be something brief, as to the significance of this problem, and to a desire of the, PSC to address that and to, you make sure that we don't leave here this year without a plan on that. And we're sitting back here next year in the budget hearing and talking about, next year I'd like to talk about what we did to fix it, instead of what we need to do to work on it. So I appreciate it, and I look forward to hearing that. So I'll open it to my other senators for questions here. Senator McClendon.
Thank you, Mr. Chairman. What amazes me about this situation is, just like what you were saying, it's basically an economic stifle, not just to Marshall County, it's to the area. And what also amazes me is how, if this was a school, it would be an F minus minus. And we have the ability to shut those schools down, if we can't get them to comply. So there has to be some mechanism, if we're in a situation like this, for us to do that. And I hope this building comes to a definite agreement on that, because it is one after another. We've got a girl at our firm that built a house there, and she's going, we've done everything right, but we can't turn the lights on. I've got babies, what do we do? And it was a terrible process. But thank y'all for being committed to that.
Appreciate your comments. I will share this too. We had one of the funeral homes in the area, and they actually testified that if the power goes off 24 to 48 hours, they can't even maintain the dignity of the deceased in the area. I mean, when you start thinking about a section of our state that can be out of power that long on a regular basis, it changes your life. You can't go on vacation, come back and all the food's ruined. You can't leave for 2 or 3 days not knowing, because it's not storm-based. It's not storm-based. It can be in the middle of the summer on a bright sunshiny day, and the power will go out. And if you see the TV PPA report, which I'll share a copy with you in the committee, once you read that and really see it, that's an independent study that was done on the system. It'll really open your eyes to how dire and what a crisis it is up there. And I will thank my colleagues. We're 100% united to try to fix Holly Springs, to try to help in Jackson Water, try to help any ratepayers in the state that are struggling to try to find solutions. So we're here to help all of our neighbors.
And that would be a perfect example to put in a letter too that you're sending to us, because as you know, in this building, when you put the human factor on it, because my intent is to bring this attention to every senator that I know, and certainly something from your department would be a great asset to do that. So Senator Michelle or Senator Butler, you got Senator Butler?
Amen.
Well said, Senator Butler.
Thank
Commissioner,
thank you, sir. Senator, one thing that we're also looking at in my district is we're assessing all 22 of our counties industrial parks and identifying the gaps that they have. Because if they don't have proper water, sewer, electrical, natural gas, broadband, and good cell phone towers in that area, sometimes you may ask, why doesn't Claiborne County have the proper economic development? Why can't they compete? Why didn't the plant go there? Well, the utilities aren't in place. So what our office is doing is assessing each county, and each board of supervisors is working with our office to look at their industrial parks to see what the gaps are. Where are you and where do you need to be competitive in economic development, so that we can come back and as resources come around, we can specifically ask for things that bring our industrial parks up to standard so that they can compete, so we can put jobs in other places, not just the places that have the proper utilities in place. And so that's to your comments. We're trying to move economic development all around the state of Mississippi. And some of our boards of supervisors are more adept. Their industrial parks are more prepared. And some of them just haven't thought about it. So we're trying to raise awareness, but also put and show them on paper, this is why you're not getting economic development. So when you make decisions at the city level and the county level, make decisions to put things to make your economy grow.
so again, I just thank each of you for taking the time to be here today. I think your input has been very helpful, not just on your budget needs, but on just the needs of what you're working on. So look forward to working with all of you. And, if you can give me some information that we talked about here, would be so appreciated, so
Good
helpful. So with that, I'll make a motion, we rise and report so we can go jump on the floor here. So.